Lung cancer today is one of the main problems in modern oncology. Annually, about 2 million people are diagnosed. Last year, 2.2 million people were diagnosed for the first time with lung cancer, and 1.8 million died from this disease. This disease ranks first worldwide in terms of mortality. Among men, it is in first place, while for women, it is breast cancer. What are the main symptoms of lung cancer? Well, let's start with the symptoms right away. First, I'll say that there are two forms of lung cancer. There is central lung cancer and there is peripheral lung cancer. Peripheral lung cancer, unfortunately, does not manifest itself in the early stages. That is, this disease, the tumor is located in the lung tissue of small size. So, unfortunately, it initially progresses without symptoms. Therefore, let's focus on the symptoms characteristic of central lung cancer, which appears at the very beginning of the disease. The first are cough, hemoptysis, and often and frequently pneumonia. That is, when the tumor obstructs the bronchus, the drainage function of the bronchus is disrupted, and as a result, pneumonia symptoms often occur. Therefore, if a cough appears without symptoms, that is not associated with any sudden illness that appeared unexpectedly, let's say, this should already be a cause for concern. A cough lasting more than a month, well, and especially hemoptysis, as hemoptysis should not be normal. Now I will talk about the symptoms characteristic of peripheral lung cancer. That is, as I mentioned earlier, unfortunately, peripheral lung cancer does not manifest itself in the early stages. But when the tumor grows to a sufficiently large size and invades the pleura, approaches the chest wall, pain syndrome occurs, or when the tumor invades. Bronchus, segmental, main, central, or lobar bronchus symptoms arise. Characteristic of central lung cancer, called peripheral cancer centralization. Again, to reiterate, this includes cough, hemoptysis, and frequent pneumonia. Therefore, as soon as these symptoms appear, it is necessary to consult a family doctor, who will then refer you to either a pulmonologist or a thoracic surgeon, after initially prescribing Nesopa. Diagnostic methods, such as at least an X-ray, but preferably, of course, a CT scan. Currently, low-dose computed tomography is the standard in the prevention and early diagnosis of lung cancer. The radiation exposure is almost equivalent to a regular X-ray, but the informativeness of this research method is quite high. Therefore, this method is considered worldwide as a screening tool for lung cancer.